Well, just ahead tonight, some amazing new medical technology. You're going to see how doctors can now find signs of lung cancer in your body without any surgery, and finding it quickly can save your life.
And the benefits of red wine. You probably know them, but do you know which red wines are better? That next.
Well, say the words lung cancer these days and people pay attention, and with good reason. Lung cancer is the leading cause of cancer deaths in the U.S., more than breast, colon, and prostate cancers combined. Early detection and quick treatment are key. Well, now technology in use at John Muir Medical Center in Walnut Creek allows for rapid assessment with no surgery.
We're not in trouble. It's going to be great.
Darlene Anatolia is just hours away from finding out if her lung cancer has spread to her lymph nodes. A vital piece of information that'll determine what's next for this 69-year-old Danville mother.
We've already got to take a tumor out of my lung that's malignant. And so we need to know if this is in trouble too.
If we find that the lymph nodes are not involved with cancer.
After triple bypass surgery, spinal surgery, and breast cancer surgery, Darlene is tired of scalpels and has opted instead for a new state-of-the-art procedure available at John Muir and just a handful of medical centers in the nation. It's a procedure that can biopsy her lymph nodes without a single incision.
It's an endobronchial ultrasound-guided biopsy.
Dr. Michaela Stretznitska, one of the few surgeons in Northern California who routinely performs the procedure, says the endobronchial ultrasound, or EBUS system, allows surgeons to venture into a delicate area of the body with minimal risk. Traditional testing involves making an incision above the sternum and then advancing a camera into the space around the trachea, allowing surgeons access to the lymph nodes.
The importance is to identify which of those lymph nodes have evidence of invasion by cancer. And traditionally, when we did the mediastinoscopy, we could biopsy these red lymph nodes, the blue ones, the yellow ones, and these light blue ones at the bottom.
With the EBUS system, there's no surgery. Instead, Dr. Stretznitska goes directly through the windpipe. The EBUS allows her to advance the scope further into the left and right side, reaching even more lymph nodes. Dr. Stretznitska already knows Darlene has a malignant tumor in her lung.
And the area of the abnormality on her lung is right here.
What she wants to know is if the glands that appear enlarged on Darlene's CAT scan are really cancerous or just inflamed.
So these are the areas that you're really going to be focusing on.
With Darlene sedated, doctors first go in using a camera scope.
And so we're looking for any lesions along the wall.
A local anesthetic is applied to the windpipe and the tumor area identified.
And that's exactly where the tumor is.
Doctors then switch to the EBUS. The flexible bronchoscope is inserted into the trachea and then pushed up along the walls of the windpipe. Dr. Stretznitska uses a Doppler to identify blood vessels. When she finds a suspicious lymph node, she measures it and then inserts the biopsy needle into the scope.
And we pass this about 15 times, making little movements.
The needle's taken out, the sample sent off for testing, all done in less than an hour. Another upside to the EBUS is just how quickly patients recover from the procedure. And in some cases, that means starting chemotherapy sooner rather than later.
The purpose of the lymph node biopsy is to really make sure that we're offering surgery to all the appropriate candidates and not offering surgery to patients where they would better be served with a different treatment option.
For Darlene, it's a non-invasive way to get some peace of mind. And we're happy to tell you that the endobronchial ultrasound found no cancer in Darlene's lymph nodes. So today, she had surgery to remove that tumor in her lung. So by having the EBUS procedure, she avoided having to undergo 2 surgeries, and she's doing really, really well. Her prognosis is good.